My name is Dr. Sam Muslin, and I am here to help the patients that I have treated that have had facelift dentistry done, and they are concerned because I've retired. They don't know what's happening with me. So I'm going to explain a few things that hopefully will help all of my patients that have had this treatment, because there's nothing to worry about. Dentists know how to repair, they know how to replace, they know how to bond, they know how to make new night guards. Dentists are very good at all of these things, and so you should be able to find a dentist that can do what needs to be done. They cannot give you facelift dentistry, but they can certainly repair, replace, because that's what they do. The two caveats you need to keep in mind. The most important two things are that your teeth weren't ground down with this method. Now, if you came into the office and you already had your teeth ground down, obviously they're still ground down. I had to do crowns or veneers or whatever I had to do, but venlays do not require your teeth to be ground down. Venlays are used for bite correction. And so none of your teeth were ground down, but the big thing is you've got the jaw track, jaw position. It changed the shape of your face. It changed your jaw position. It made you healthier. And so facelift dentistry and the dental facelift are both federally trademarked. No dentist is allowed to use these. Be careful. Dentists that advertise this, I'm not sure I'd go to them, because if they're dishonest about this, they're going to be dishonest about other things too, in my opinion. So what should you do? Gosh, doctor, what should I do? You've retired. Wear your night guards. If you wear your night guards hold your bite, protect your bite, stabilize your bite. They keep the teeth aligned, they keep the bite aligned, they keep the jaw position. If you don't wear the night guards, you're like a sinking ship, very slowly. You need to get your teeth cleaned by dentists. Take x-rays, look at this, fix what needs to be fixed if you get a cavity or something. Floss, brush, water pick every night before you go to bed, every morning when you get up, then you don't get cavities. Take care of yourself. Keep in mind, you're living 3 decades longer than 50 years ago. 50 years ago, most people died between 60 and 70. 65 was old. Lots of people died. Now most people are living much longer, and unfortunately, their teeth are short, they're worn down, they're yellow, they don't look good. You go to a dentist, they want to do jaw surgery, or they want to grind all your teeth down, and those are horrific options. So they'll put you to sleep and hopefully you wake up. And so there's problems with that. So my point to you is facelift dentistry is a huge improvement. This is what my night guards look like. This is what a night guard dentist can make these. And this bite is being balanced. That's the blue marking, where I'm marking it to make the night guard comfortable to you. So the dentist should balance your night guard. He should make it comfortable to you. That's the key to it. And I like to have them 1.5 to 2 millimeters short, or thickness, the thickness of the night guard. You can go 3 millimeters, you can go 1. 1 millimeter breaks too easy. 3 millimeters starts getting a little thicker, but some people like them. My point is, you have choices of thickness. That's important. Well, then you say, well, all right, I got the night guard thing. What about the venlay? What if my venlay chips? Well, here's a little chip in the venlay, and it could be bonded. You could just bond that little, or you don't have to fix it at all. Like one patient said, nobody can see that. It's my lower teeth. Can't see that, so I'm not going to fix it. Great. Well, but dentists can fix, they can bond, they can replace. Why was facelift dentistry invented? Well, the reason why was your choices were bad. As a dentist, I didn't like your choices. Basically, if your teeth were crooked or if your bite was off, they wanted to put braces on your teeth. Well, we could put braces because your bite's off. You have an overbite or an underbite or a crossbite or something like that. Well, let's just say after the braces were on, a lot of times they would then tell you, oh, you have to have jaw surgery. Oh, no, the only way to fix this is with jaw surgery. Wrong. But let's say you had jaw surgery. What happens then? It didn't work. So what happens now? Oh, you need another jaw surgery. Wrong. I've treated patients that have had jaw surgery and patients that wanted to avoid it at all costs. That's why Your choices were all invasive and they were time consuming and you didn't know they're gonna work. You can't test jaw surgery, you can test facelift dentistry. Now, why didn't you teach this? I'm under attack for that. Why didn't you teach facelift dentistry? Well, the point is this. This is a complicated method, a very complicated method, because there's no two people that are alike. Every jaw track appliance that's been made to test you has been custom made. It's unique to you. Nobody else could wear it. It's designed to help find the jaw position. And when a patient comes in and they have headaches, which a lot of you came in, you had headaches, you had this, whatever your symptoms were, the bottom line was we would make the jaw track appliance, get you a new jaw position. You would be much more comfortable in that new jaw position. Why? Because that's the position she was always supposed to be in, and this position was the position that the teeth were forcing your jaw in. She had an overbite, and so she closed, and her bite forced that jaw back. It's a normal sized jaw. No chin implants, nothing was done here other than facelift dentistry, getting the jaw in the right position using the jaw track appliance and then building a new bite for her. It's a revolutionary method. I need to teach it to a lot of dentists at one time, and basically the retirement will help me do that. This patient already had 10 porcelain veneers, already had her teeth ground down. She took this picture with her cell phone in the dental chair, and this was one ticked off patient. Very upset that her normal, healthy, totally intact teeth were cut up like this. And so here is a plastic surgeon, a very prominent plastic surgeon, and she knows this is a structural correction. She can't do this in plastic surgery. Plastic surgery cannot change the shape of your face. Look at her face in the before picture. Look at her chin, her jawline in the after picture. Try to look past the teeth for the moment. Just look at the face, the shape of the face, the lips. These are the exact same lips. People said, well, did she have her lips augmented when you put? No. These and these are the same exact lips, same chin, no surgery, no implants, she didn't even need a shot. All of her teeth had a new layer of porcelain bonded to them after she got the jaw track jaw position. Look at the shape of his face. The shape of his face is like of an older person, 60-year-olds and 70-year-olds. They have facial collapse, their face is getting shorter, it's rounder, and look at the jawline now that he has after facelift dentistry. This is probably, 5 years later. Nice. I want to sincerely thank all of you for choosing me as your dentist. It honors me that you have flown from all over the world, Australia, New Zealand, Singapore, Bangkok, all of the places, London, Europe, South America, Canada. I've had treated patients from everywhere, and I am honored that you chose me. I'm honored that you read about this on the internet and went through all the trouble to fly out here to get it. Some of you were on 17-hour flights. I mean, I can't even imagine that, but I want to thank you. It's been a pleasure treating you.